I definitely understand how folks are doing this morning.
I'm sorry, Becky, just give me one additional moment. I'm
You are
having some
totally fine.
trouble getting it
We
to
can go ahead
bring
and
up the.
welcome people this morning. Good morning, non-public school leaders of North Carolina. I am Becky Blanchard, or Rebecca, either is fine. I am our Senior Policy Advisor with the Department of Health and Human Services. Some of you may have joined us for the last webinar that we had together, bringing together non-public school leaders from all over the state. Really, the last time we did this was in December, and that, to our knowledge, is the first time we've ever done something like that as a state. So this webinar is our second time doing something like that as a state, and we are so glad that all of you are able to join us this morning. Thank you so much, Jenna. Welcome to your second non-public schools webinar. If you can flip to the next slide, Jenna, that would be fabulous. Before we get started, we've figured out that you all have access to the Q&A function. So I think I had asked folks to sign in and say hey in the chat, and Lori followed directions just so well. Love working with education people. If you have questions throughout our conversation this morning, please feel free to enter them into the Q&A, and we will be able to answer them as many as possible live in the moment, and we'll incorporate them to what we're talking about. But know that this webinar will be recorded and will be shared with you via email along with today's slides as soon as possible, concluding after we conclude our presentation. Next slide, please. So as I mentioned, this is your second webinar as non-public school leaders, and we have learned a lot about how to share webinar recordings from WebEx on our state WebEx account. And that first webinar is actually posted online for your viewing pleasure. And I highly recommend, if you weren't able to join us previously, or you did and you just want to relive how powerful that presentation was, I strongly recommend that you take a look at the link, our DHHS COVID schools guidance webpage. You can probably Google search those terms and find it real quick there too, and you'll find a link to this webinar. In our last webinar, we really spent a lot of time getting into the basics of COVID, getting everyone on the same page about what COVID is all about, what we know about COVID, what we know about vaccines, and just best practices for our non-public schools. Next slide, please, Jenna. Thank you so much. And we also talked about, just briefly as a recap here, that our non-public schools are actually very diverse and are not a monolith. So bringing all of y'all together in one webinar, it can be pretty cross-cutting in terms of the issues that you want to cover and the topics that are on your mind. So these are some of the stats that we shared last time. Next slide, please, Jenna. So today, we're actually going to hone in a little more specifically on a couple of topics rather than go more broadly in terms of an overview of COVID. So if you're looking for an overview of COVID or more background on specifics, please revisit the last webinar that we did together, and we'll also be happy to follow up with any more broad questions offline if you write them to us in the Q&A. Today's time we'll spend together mostly talking about rapid antigen testing being available to all of you for free, as long as you can meet the requirements and criteria that Natalie will walk through. Natalie is our program director of COVID testing here at the North Carolina Department of Health and Human Services. So that's where we'll spend the bulk of our time today, but I'll also give a brief set of updates about what was released this week and what has recently changed in our K-12 public health requirements for our public schools across the state, which we strongly encourage our non-public schools to follow. And I know many of you already are. And I want to give a special thank you to Shanae Flood, Joe Haas, and Linda Nelson, who are our state and private partners who have been just so supportive throughout this process of figuring out what does it mean to support our non-public schools during COVID response. So thank you all for your ongoing effort and support. Before we dive into updates and most of our focus time on rapid testing, you're perfect, Jenna. We are gonna kick it off with this lovely headshot and Jeff Coltrane out of the governor's office, who's gonna welcome us to the conversation this morning on behalf of Governor Cooper. Jeff, I'm gonna hand it over to you to welcome our group.
Thanks so much, Becky. I feel like in the world of Zoom and webinars, we're all living in headshots. But good morning, everyone. Thank you all for joining us today. Really appreciate it. And on behalf of Governor Cooper, just want to say thank you for all the work that you as school leaders have done over the last year. We all know this last year has been anything but normal. But a lot of our public and non-public educators and administrators have really worked hard to try and meet the academic and physical and mental health needs of our students over this last year. And I know many of you have been working hard to provide in-person instruction for this past year, and really appreciate those efforts that you've made and the great work that you've done. Also want to thank Shanae Flood, Joe Haas, and Linda Nelson for their ongoing partnerships through this work. You've got some great leadership here at the state level that's really helping to work collaboratively with us, but also to support the work you're doing at the local level. And so many of these efforts that we've undertaken here would not have been possible without that support. So just want to say thank you as well. I wish you all a successful last sprint here for the end of the school year. We're really beginning to see the light at the end of the tunnel from this pandemic. We still have a long ways to go, so we need to keep pursuing our mitigation efforts and masking and distancing where possible. But I think we're all beginning to feel cautiously optimistic that we're gonna be able to successfully recover and then build back stronger than we were before. So just thank you again for all the work you've done and for everything you've done for your students. And I'll turn it back over to you, Becky.
Thank you so much, Jeff, and thank you for your just ongoing effort and partnership, even in tech support and leading WebExes. Who knew? You can go to the next slide, Jenna, and thanks to Jenna Dart from Ernst & Young, who's just been pretty essential in all of this response, particularly around rapid testing. So you'll hear more about that. So, and I don't think I did introduce myself, but just to make sure, Becky Blanchard, Senior Policy Advisor. I have had the pleasure out of our Department of Health and Human Services to coordinate our ongoing K-12 COVID response. I myself am a product of non-public schools in Durham in particular. So thank you all for your leadership. Okay, we're kicking things off with a brief update around what is new, what has changed in our K-12 public health requirements. Hopefully you received or were forwarded a couple of emails this week, or maybe you heard in the media this week that we've made some pretty exciting updates to our K-12 public health requirements and recommendations in North Carolina in alignment with federal recommendations that have been made and changed in the past month. Next slide, please, Jenna. So the CDC released back in February and then updated again just about a week ago, maybe a little bit more, their specific operational guidance for schools serving kindergarten through 12th grade in the US. Potentially you are already well versed in what the CDC has released, but if not, I encourage you to take a look at it. The link is, and the source page is at the bottom of this slide when you receive it. But I think overall, we were very pleased to see that the CDC's recommendations for schools nationally really mirrors and aligns with what North Carolina has been putting out and taking the lead on strongly since last August, when the traditional school year started. First and foremost, the CDC at the federal level recommends and directs the consistent use of mitigation strategies across the board in our schools. And especially they emphasize universal and correct use of masks, cloth face coverings that have 2 or more layers that fit snugly around your nose, over your nose and your mouth. They are absolutely key and are emphasized by the CDC as the most important non-negotiable in our K-12 classrooms. They also have provided clear recommendations around physical distancing. Just a note, we are no longer using the term social distancing in alignment with the CDC. Physical distancing is the term. They came out with some specifics last week to say that 3 feet of physical distancing is recommended at a minimum for students, but 6 feet is recommended as a minimum between adults and between adults and students. So for example, 6 feet of distance is recommended between adults in, let's say, a break room at a school, and 6 feet of distance is recommended between a teacher teaching in the front of a classroom and the first student closest to that teacher. But 3 feet at a minimum is recommended by the CDC, student to student, so potentially between desks, for example. The CDC also recommends vaccines and prioritizing our teachers and our school staff as an additional very important mitigation effort in terms of helping stop the spread of COVID. And hopefully you're all very aware by now that our vaccination priority back in group 3 was our school K-12 and childcare staff being able to get vaccinated early on. So hopefully your school staff are already vaccinated. And if not, your encouragement and support moving forward is just so important, not only for your own staff, but in your communities as well. And if you haven't yet heard, yesterday, maybe the day before? It was yesterday. Governor Cooper announced that coming up on April 7th, all folks across North Carolina, without any more groups, will be eligible to schedule and receive their COVID vaccine, which is so, so exciting. The CDC also recommends that K-12 schools support their local health departments with facilitating contact tracing in combination with emphasizing and requiring isolation for folks that are sick with a positive case of COVID, or quarantining them for folks who are suspected of having a COVID case and who are symptomatic, for example. And that's completely in alignment with DHHS guidance. And then the last, which is where we're going to be spending our time today, is that the CDC specifically called out and recommended diagnostic and screening testing as an additional layer of mitigation for COVID in our schools. Next slide, please. We at DHHS responded accordingly by making sure that our guidance was mostly already in alignment with what the CDC put out, but we clarified a few things this week on Wednesday and then did a couple additional wording clarifications just yesterday. So again, hopefully you've received word about those guidance changes. The first, I think, is exciting for our schools in terms of operations, that daily symptom screenings are no longer required in North Carolina for our K-12 schools, but they can be considered for adults, though they are not recommended for children. And that means no more daily temperature screenings, no more checking folks at the door to see if they are symptomatic. That is potentially game-changing in terms of staff capacity on our campuses. And we can talk more about that in terms of what staff capacity that might free up to implement something like a screening testing program on your campus. I do want to note that although symptom screenings are no longer required on our campuses, exclusion of students and adults based on COVID symptoms still applies, as well as exclusion of folks who are a close contact of someone who was COVID positive, or if they have disclosed that they are COVID positive. So exclusion still applies if folks present with symptoms or share that they meet any of those criteria. But we are no longer recommending that schools spend a significant amount of time and energy every single day to symptom screen every individual on their campus. We also incorporated CDC guidance around those physical distancing recommendations that I mentioned before, around a minimum of 3 feet. That's a recommendation of ours. And we've been emphasizing that all grade levels from K through 12 should return to full-time in-person instruction as much as possible, 5 days a week. And we know that many of our non-public schools have been doing that since day one. I do want to highlight for y'all as well, this last bullet here. This is a question and something we've received just ongoing questions about from our non-public schools in particular since last year, that the CDC does no longer includes any recommendations in their operational guidance for K-12 schools around physical barriers, such as a clear plexiglass wall between students. And I think that's important to note because many of you might be using those. So the CDC doesn't have any evidence to support any recommendations on those barriers, and instead is really continuing to emphasize the importance of a minimum of 3 feet of social distancing between students. So just wanted to highlight that there. I encourage you, I'll check the chat when I'm in just a second, but I encourage you, please drop in questions that you have as we're moving along in this presentation. I'm gonna hit one right now here. Would a fully vaccinated teacher still need to maintain 6 feet of physical distance from students? The answer is yes. That is still recommended in our schools. And however, you'll note a recommendation in our guidance now that states a fully vaccinated individual is no longer recommended to have to quarantine if they are asymptomatic, but they are a close contact of someone who is COVID positive. So you'll see some nuance in the recommendations there, and the CDC will continue to adjust their recommendations, and North Carolina will follow suit as more and more folks get vaccinated across the country. Next slide, please. So I've talked very quickly, and again, as you have more questions, please don't hesitate to drop them into the chat. There's one more that I'm also going to hit on. Does exclusion still apply to household members? We no longer see this in the toolkit and want to verify. The answer is no. Household members who are, anyone who is symptomatic or a close contact or who has disclosed that they are COVID positive is to be excluded from school. But because we're no longer recommending or requiring symptom screenings for adults and kids, we're no longer recommending that you automatically exclude household contacts. If they fall into any of those other exclusive categories, then they would need to be excluded. But you'll see that is no longer in there. You're exactly right. Okay. With that, if there are other questions that come up, and I see some more, I'm going to answer them via typing. But for now, we're going to switch gears and we're going to spend the rest of our conversation really focused on the importance and benefits of rapid antigen testing on our campuses in our K-12 schools. And I have had the privilege of working with Natalie, who I'm going to hand it over to in just a second, who leads our COVID testing program for DHHS. And we have been working together to really align again with the CDC, who recommends that our K-12 schools implement testing programs as much as possible on their campuses. And that when we implement COVID testing on site through rapid testing, where we get rapid results, we can stop the spread of COVID that much more quickly, which is incredibly important right now. As we know, adults are continuing to get vaccinated, but our kids still are not eligible to be vaccinated yet if they're under the age of 16. And that's the majority of our K-12 students. So this is such a critical strategy. And in particular, we see a really big bang for your buck in terms of the efforts that you could put in as a campus here to standing up a testing program, as opposed to the effort and energy you may be spending on a symptom screening effort every single day. So I think that's the key idea, and we want to spend our time walking through the basics of when and how you could stand up a testing program on your campus utilizing free diagnostic and screening tests available from the state. I'm going to hand it over to Natalie, who's going to start off with just some background on actually like what are we talking about here, to make sure that everybody's up to speed, and we'll continue to take your questions. And Natalie, we will tag team on these next couple slides. So I'm handing it to Natalie for the next one.
Excellent. Thank you, Becky. And like Becky said, hello, I am Natalie Ivanoff, and I co-lead our COVID-19 testing team at DHHS. Been working very closely with Becky to be able to provide testing tools needed for schools to be able to create a testing program that works for them. And many of you might already be testing in your school. So a lot of this might be refreshers, information that you already know. But even if you are already testing, I would like you to kind of think about what we're talking about here and see if any of these resources that we're providing might be able to help you enhance what you're already doing. So, like Becky said, we're going to dig into a quick science refresher before we go into the operational details. There are a few ways we test for COVID-19. Molecular and PCR-based tests and antigen tests diagnose a current infection, while antibody tests detect whether someone was infected in the past. If we narrow down to the tests that you do to diagnose a current infection, PCR tests, the lab-based tests, they have a high accuracy, but because they require processing in a lab, the turnaround time between swab to result could be a few days. Antigen tests, on the other hand, and that's what we'll be talking about today, they don't usually require a lab to process results, so they tend to be cheaper, and they also have a faster turnaround time, usually within 15 to 30 minutes. But the trade-off here is that they could be less accurate than PCR tests. We'll go to the next slide. So we'll go through this briefly because Becky did cover this already, but the CDC did release their updated operational school strategy earlier this month, where they did emphasize diagnostic and screening testing for COVID as a mitigation layer that you should combine with many of the other strategies you've already been doing, such as mask use, hand washing, physical distancing. And there are two types of testing that the CDC talks about. One is diagnostic testing. That's when someone who is symptomatic or they're a close contact comes in to get a test to see if they might have COVID, while there's also screening tests, which means that you're testing a percentage or group of individuals regularly, so weekly, for example, even if they're asymptomatic, just to see if they could have, if they could have COVID, they could be asymptomatic spreaders. And that is a new thing that we've kind of expanded our K-12 testing program to include, because we do think that that regular testing could be a beneficial mitigation layer for your schools. Next slide. So some additional background. So last fall, the federal government procured a whole bunch of Avid Biomex Now tests. These are antigen tests, and they gave North Carolina a share of that. As these are antigen tests, they're designed for rapid diagnosis of an active infection, usually 5 days of symptom onset, but we have seen them start to be used for that screening strategy. They can be administered by anyone who's undergone training by Abbott, and that's why they are particularly useful in some of these non-traditional settings like schools, because you could train your nurses or other staff to be able to do this, even to just observe someone else do the swabbing. And these tests can be done in any location. They don't have to be a lab, as long as they have that CLIA certificate of waiver. And we'll touch on that a little bit later on. So as you're aware, we did pilot diagnostic testing in K-12 public schools over the winter. And we've had some great success with that. We've heard, as Becky said, the effort to stand something like this up really did make it worthwhile. You know, they were able to feel like students felt more comfortable coming back to school. Families felt like they had another way of accessing testing if they needed it. And overall, everyone's very happy with the program. And so we're now expanding this to everyone. So we're very excited to be talking to you about this today. So then, yes, based on this feedback, based on lessons learned, we're expanding this widely, both for diagnostic testing for everyone, adults and students, and then also the use case of screening for all adults in the schools statewide. So this can include your staff, your teachers, bus drivers, anyone that might be working for your school. I want to remind us all that this is opt-in. So if you want to add this as an additional mitigation layer, feel free, let us know. We can help you kind of stand this up. If this isn't something you want to do, you can also decide not to. This is not required. So there are a couple of use cases here that we've heard from other schools have been pretty successful with these tests. I mentioned diagnostic testing and screening. Other use cases include screening student athletes, as well as screening prior to tournaments, as well as screening before, you know, certain events like graduation or prom or coming back from spring break. Those are all use cases we've talked about with other schools, and you can use these tests for all of those purposes. We will provide these tests through the end of the calendar school year, and schools can start requesting tests now. These are all open to you starting officially last Thursday, the 18th. But before you can request these tests, there are a list of requirements that your school would need to fulfill, and we'll have all of those listed on the next slide. So I won't go through all of these, but we will circulate these slides afterwards, and these links will be helpful for you to kind of dig in further, or you can feel free to email us at Strong Schools NC, and we can handle any questions you might have. The two things I did want to highlight here, and actually probably three, is the CLIA certificate and reporting. So, you know, CLIA certificate of waiver is essentially just approval from the CMS to be able to do testing in your location. You might already have this. A lot of schools already have CLIA waivers for other testing that they do, like, you know, blood sugar screenings. And if you are already doing antigen testing at your school, you probably already have BinaxNOW on that listing. So this might not be anything you need to do additional effort on, but if you do, there is an application you would need to submit. And your nurses will be able to let you know if you have a CLIA. The other thing I wanted to make sure we highlighted is reporting. So reporting, we've heard from other schools, can be difficult. And so we have set up an online web portal that you can use to be able to report your tests. And our reporting team has offered to have a weekly call with schools who are interested in learning how to use this tool and, you know, getting themselves set up. So if you're interested in doing that, please let us know, and we can get you on that list to attend those calls. Other things not specifically on this list that I also want to make sure we highlight was, you know, questions around who does this testing. So this can take several forms, and that's what we've seen. Some use, you know, in-house nurses, others pull in local partners to do that testing. And, you know, I also wanted to mention that you can use local partners for any of these requirements. It doesn't have to be entirely in-house. You know, use your relationships to be able to build a program that makes the most sense for your students. And then that other thing, oh, yes, Becky?
Nope, I think you should keep going, and I'm going to mute myself again, but would love to jump in and walk through a couple examples of what some of these local partnerships might look like, but I'm going to pause and let you finish.
No, why don't we do that? Because I was going to get to funding. So I think this is a good time to do that.
Fabulous. Perfect. So when we, Natalie and Jeff and Jenna and I had a meeting earlier with our wonderful independent school partners, Joe and Linda and Shanae, that we mentioned at the beginning. And one of the things that we were talking about is how many of our independent schools across the state might already be partnering with local organizations. What a partnership might already look like on your campus is you might have an established place or an established partner where you are sending kids or you are sending adults who are symptomatic, who show up at your door symptomatic at your school, and you send them over there to get tested. We've heard that this has been working well for many of you. It does sound like we haven't heard as much about screening testing taking place in our K-12 schools. And one thing I just want to give an example of what screening testing might look like. Maybe you've heard about some of our universities in North Carolina and across the country implementing really robust screening testing strategies. So Duke University, for example, made some national headlines at the beginning of COVID where they have been randomly testing a percentage of their students and faculty on a weekly basis to catch asymptomatic cases and then exclude those people, quarantine those people, isolate people who are COVID positive as a result from these random tests. That would be the same idea in screening testing that could take place with your campus. You could test once a week all of your staff. We don't recommend screening testing for kids, but you could screen test all of your staff, and that helps you catch anyone who would be asymptomatic and a positive case. And that will immediately stop the spread of that positive individual. That's what this is all about. And so that could look like you screen all teachers at the door every Monday at your school and you do the testing on site. Or this could mean you partner with this same partner you've been sending symptomatic people to. You could send all of your teachers and all of your school staff there once a week, for example. But that's what we mean when we're talking about doing this independently or partnering. Natalie, anything to add there?
I think it was great that we got into those examples because I think that helps kind of make this real and not just like a theoretical exercise. So really much, I really appreciate that. Thank you.
Absolutely. And I'm seeing a question that from Susan asking, how do we let you know if we would like a call about the testing protocols? And I urge you, Susan, if you can write maybe some more about the specific questions that you have around COVID testing, now would actually be a great time to ask them. So feel free, but we'll also provide our contact information for additional questions. So a couple more are coming in, Natalie, that before we move to how you could pay for this, I think these are great questions for you to take. One is
on the really quick, Becky, on the, you know, how you also want to ask questions about testing protocols. If you are not able to get through all of your questions today, we also host weekly hours on Fridays. So we will circulate that when you request tests from us, and actually we can probably just share it with everyone on this call, honestly. You'll be added on an invite for our Friday morning office hours. So feel free to join, and we'll have a couple of hot topics that we'll like cover for 15, 20 minutes. But the rest of the time is time for you to ask questions either to us or others on the call. It's a great collaborative environment because some folks have been testing for some time, others are just now starting it up. So it's great to kind of hear what everyone's head's at different phases of the process. So back to you.
You're so awesome. Perfect. Sonia asked a question that we've gotten a lot, is where do we go to obtain a CLIA certificate? Could you talk just a little bit more about CLIA certificates?
Yes. So I'm going to preface this with I am not a CLIA expert. So this is what I have been learning through this process. But we have a link here, which Jenna is hovering, that goes to the CMS website for CLIA. And essentially, you fill out a really quick form, honestly, essentially just asking for the okay to be able to do this testing in your facility. I think it has some questions about, you know, are you prepared to, you know, throw out materials, you know, in a correct way, have PPE, things like that, stuff that you would already be doing if you're doing testing. And then that form will go to our state representatives of the CLIA process. And there's also a fee. I want to make sure that we're transparent with that. I think it's around $150. I should have looked this up ahead of time, but I think it's around that amount just for the certificate. And then our state partners will review and should get back to you, I would say, within 5 business days. And so it's generally pretty quick. It's more just, you know, making sure you're able to check that box in the process. But if you have any questions as you go through this, our Strong Schools NC email address is where you can direct them, and we can either, if we can answer them ourselves, we will do that, or we will pass that along to our CLIA friends at the state.
Awesome. I'm going to hold on the next two questions because I think they're good after we kind of walk through next steps if this interests you. So next slide, please. Unless, do we miss anything, Natalie, on this one? Okay.
No, I was going to go to funding.
Perfect. Jeff Coltrane, if you're still available to pop back in, a question that Natalie and our team and Jenna have gotten quite a bit is, how can our non-public schools access additional funds to support a testing effort if they want to expand what they're doing locally? And I know, Jeff, that you want to talk about the EANS funding a little bit here.
Absolutely. And thank you, Becky. And just a reminder that the tests themselves are free, but this could be funding to help support your administration, staffing, training for the test. So in the CRRSA Act, the Federal CRRSA Act that passed in December, the federal government created a program called the Emergency Assistance for Non-Public Schools program. And this program provides aid to non-public schools to help with COVID response, as well as addressing the needs of your learners based on the potential issues they face during COVID. The program, the grant funds technically come to the governor's office, but by federal law, DPI has to administer the program. So we've been working very closely with the Pandemic Recovery Office, DPI, the State Education Assistance Authority, which oversees the Opportunity Scholarships and the Disability Grant programs that work closely with you, and the Division of Non-Public Education at the Department of Administration on getting this program set up. And just yesterday, applications opened for this program, and so I wanted to make sure that you were aware. These funds can be used to help with COVID-19 testing and tracing. So this could be an allowable use for these programs. And the way that the program works is that as a non-public school, you would submit an application to DPI saying that you're interested. They have determined a planning allotment per school, per eligible school that would be available. And that's also on their website, which is linked on here and will be available after this webinar. The program can reimburse you for any services, costs, purchases you made, going all the way back to March 13th, it's COVID related, or can provide aid to help with future purchases or costs. Because these are public dollars, the state has to maintain control of the funds, and also for any purchases that are real property. And I think in this case, thinking more like computers, the state retains the title of those purchases, but obviously they are available to you to use. So the program is similar in that respect to the equitable services provisions for Title I funding that some of you may work closely with your local school districts on. So the EANS application is open now. DPI has offered a couple of webinars. I believe there was one yesterday and maybe one this morning, or it's coming up early next week. Those might have been recorded, but the federal programs monitoring team stands ready to help answer any questions you have. The application will close on May 31st. I think that's a typo on there. So you have from now until May 31st to submit an application for those funds, and then the team at DPI will follow up on next steps from there. And I'm happy to answer any questions as best I can.
Awesome.
But yeah, so that is an available resource for you if you're, well, for anything COVID related, but particularly for testing, if you're interested in trying to do some screening testing, these could be resources that you could use. So
awesome. Jeff, thank you. Thank you. I want to make sure that we close out on the next step slide, so folks know, what to do next if they're interested. And then I think we should just open up and answer some of these great questions that are coming in. And Natalie, thank you for putting answers in writing already. Natalie, I'm happy to go through this, and if I get anything wrong, you tell me. As Natalie mentioned, the online request form and testing guidance are live now and available to you right now to go ahead and apply. And the link is included somewhere in this guidance, and we'll drop it into the Q&A as well to make sure that you have it. It's also linked in the Strong Schools NC Toolkit. You could also probably Google NC DHHS COVID testing K-12 schools. I bet you'll find it pretty quickly, if that is faster than us even dropping the link in that Natalie's already done. You can begin requesting tests as soon as you're able to demonstrate that you can meet those testing requirements that Natalie went through on the previous slide. And Natalie also already mentioned that we have learned from the schools across the state that have already been doing this, using these free state tests, that providing a weekly touch point is really helpful to answer ongoing questions. So thank you to Natalie and Jenna from our team who are running these weekly office hours. Again, they're very collaborative. We're also specifically hosting training sessions on how to report your test results through our online eCater system. But overall, I think the big key point is if we can't get to your question today, that make sure you send an email to strongschools@dhhs.nc.gov. That email address is on the slide right here for any questions you have at all. And our testing team is just on top of it, and they will answer whatever question you have. And I hope that you've kind of heard in our voices and the way we've been talking about screening testing is we at DHHS, our federal government, at the CDC, we really see value in our schools standing up testing programs. There's a train going by, so forgive me if you hear that in the background, but that we believe that this is an important and good use of your time as schools, as you are figuring out what to prioritize at this point in your COVID response. Can you flip to the next slide for us, Jenna? I just want to flag, and can you flip 2 more slides for me? I tucked in some extra resources for you in the back of the slide deck you're going to get, because I just want to preview that as our vaccination efforts continue to ramp up as a state, and as our country has an increased vaccine supply, we are going to need as much help as possible in our communities to get the word out to families of your students, to families of your school staff to get vaccinated. And I want to flag for you that there are links to the COVID communications toolkit in the second to last slide in the deck. And next slide, please, Jenna. There's also a link to just our online Your Spot, Your Shot at .nc.gov website. That's a good kind of central hub for all things vaccine. So getting the word out on vaccines is also just going to be super important. Thanks, Jenna. Can you skip back a couple slides to our FAQ? Perfect. Let's leave this slide up, and Natalie and Jeff and I are happy to highlight some of the questions that have come in on the chat. I think one that I wanted to start with, Natalie, that you answered in the chat is, you know, as we've vaccinated more and more people across the state, why stand up a screening testing program now on our campuses? What's the value?
Is a very fair question. And, you know, we are still learning as we're going through this, right? And the current guidance that we've heard from the CDC is that if someone is vaccinated but symptomatic, they should still be tested. And that's for a couple of reasons, right? One is, you know, as always, if they are COVID positive, we want them to stay home and not spread it further. But also, it also gives us some additional information about the vaccine, right? If someone is vaccinated but is positive for COVID, what does that mean? That can help us, you know, adjust our response accordingly. But for your purposes, I think that is the rule of thumb. If someone's symptomatic, definitely test. So if you're thinking of, you know, doing any testing, bare minimum, make sure it's diagnostic testing.
Thanks so much, Natalie. It's a great, great question. Hey, Jeff, there's one for you from Mark. Could the EANS funds be used to help cover additional nursing personnel and support?
I believe that it can. I would refer you to the information on DPA's website about the program just to confirm, but I'm pretty sure that it can. I think it's allowable for any type of COVID response mitigation efforts, which I think would include nursing. But again, I would refer you to the information on DPI's website about the program, and then if that doesn't answer it, then to the federal programs folks at DPI.
Thanks so much, Jeff. Lisa asked a question that Natalie already answered, but I think it's worth flagging. Will the tests that are provided from DHHS be available for family members of students and staff as well?
Yes. So short answer, yes. And we've heard from a lot of our pilot schools that this was a key part of their offering. They felt like being able to offer it to families helped the families a lot, because some families just can't get to a testing event, or they don't have a healthcare provider that they feel comfortable going to for something like this. So being able to get a test for free at school was just a huge benefit. I would, kind of return the question back to this group to say, make sure that as you're standing up your operations, if you do want to include families, make sure you're accounting for that in your staffing models, in your just regular operations, because there are just additional people you will be testing. But from our perspective, feel free.
Thank you so much, Natalie. That's great. I want to highlight that Whit in the Q&A said, thanks for the response. I'm not sure which Q you answered, Natalie, but I want to flag that Whit mentioned that they're thinking about surveillance screening of students before special events like commencement and sporting events, etc. Is there anything that you want to say about that, Natalie, in terms of why we recommend that and why that's of added value?
Yeah, so we do agree with that, and we're hearing that from a lot of schools. And I think being able to provide testing ahead of events like this help us kind of return to normal, right? Like, people want to be able to graduate with their classmates. They want to continue to have sporting events. And so, while we might not recommend like graduation indoors, like if you will move forward with having graduation, this is an additional, mitigation layer to make sure people feel safe going to one of these events. We would recommend, if you do choose to do something like this, that you either test the day of or within 48 hours before the event. And that's because these tests are those, point in time tests. They can tell you at that moment if somebody has COVID-19. So you don't want to do it too far ahead of time, because things might change between when the test was done and when the event is happening. So just something to think about as you plan this out.
Perfect. Thank you so much, Natalie. I want to go back to a question that Glenn put in the chat earlier. Glenn said, I believe Natalie said the program will run through the end of the school year. Are there plans to extend through summer programs and/or into the 2021-2022 school year?
So we are currently thinking about what the summer looks like. We've been having various conversations with different partners about summer programs, summer school, and at this point, we don't have an official answer, but I feel pretty confident that these will be offered through the summer. As far as the fall and the rest of the, the next school year, we are constantly looking at new tech and new guidance from the CDC. So I think right now it's a little too far in the future to be able to say what the fall would look like. I think another thing we need to think about is this federal program that they're standing up. I don't know if folks here have heard about that, but the federal government has come up saying that they want to build these hubs and they want to invest money towards school-based testing. And so we need to keep a close eye on what that means, because it might impact our strategy. So all that is to say, it is very much top of mind. We just don't have a clear answer quite yet.
Thanks so much, Natalie. Amanda asked a question about the accuracy of these tests at detecting asymptomatic COVID cases. Can you speak to that?
Yeah, that is definitely something to think about as you're standing up a program like this. They are not as accurate as the PCR, which is that lab-based test, but that is that trade-off for getting something with a quick result, right? From what we've seen from our other state partners that are using this specific test for school-based testing is, actually they've been generally happy with the results. There are some cases of, false negatives, false positives, and that's why you should follow our antigen guidance, which I've linked to, I think, a prior question, which has a little chart to say, depending on the scenario, do you need to follow up with a PCR test just to confirm that what you've gotten in that antigen test is correct. So that is an important thing to think about as you're standing up a program. We'll be providing the antigen test, but you might need to have a PCR strategy, whether that is asking the family to bring that student to a community testing event to get a PCR-based test, or if you already have a partner, making sure that they are available to be able to do that testing. That's something you'll also have to think about. And I can point to guidance and other things or continue talking about this if you have questions.
Awesome. What other questions do folks have? Because we have 9 more minutes and I don't think we've run early on anything since COVID started. So this is a weird feeling for me. So if you have questions on anything related to COVID testing, funding, anything in our updated guidance, anything from the CDC, we have some time right now. And we are all yours. And Jeff, I don't know if there's anything you wanted to add, or Jenna, if there's anything that we want to preempt, anything that we expect might come our way.
I see we have one additional question in the chat from Linda that she was asking when we can expect to receive our tests as they've completed all the requirements. So Natalie, I'll pass that to you.
Yes, great question, Linda, thinking ahead. So when you submit a request through that online form, which we can, circulate again after the call, it will go to a member of our team, and we usually review those about twice a week, maybe more frequently if needed, but twice a week has been the cadence we followed thus far, and then we will get back to you with a decision. And if we are going to ship tests to you, which we very likely will, that will come to you within 2 to 3 business days. So I would say within a week is when you should be hearing back from us with the shipment information. Usually, I say that you're going to hear back from us in a couple of days in case we have follow-up questions, but rarely we do. So as you're thinking about requesting tests, consider that 1 week turnaround time. And also think about, how many tests you'll need in a 4 to 6 week increment. That's generally what we recommend people request for. And that's to make sure that you're able to use these tests and they're not just sitting on shelves, because we have a limited amount of tests and we want to make sure whoever needs them gets them. So just something to think in mind as you're planning.
Thanks so much, Natalie, and thank you, Jenna. I'm also thinking about one of the conversations that we had with Linda and Joe and Shanae earlier was, our non-public schools might see a benefit in partnering together with local public schools or with each other even to stand up their testing programs. Think about the marginal benefit of sharing staffing or sharing just like the infrastructure, the space that you might need to conduct these tests and the training process. So I think there are some real opportunities here for relationship building between our education institutions locally and your local public health leaders. So this is just a great opportunity all around. And the other thing that's on my mind too is just kind of playing forward what it means for our kids to still be unvaccinated, and how our conversations around COVID will continue to change over time as vaccine becomes available for our children under the age of 16. But until then, let's keep thinking about testing strategies as a really important mitigation layer, and that there's such a huge benefit here. Anything else to flag? Are there any other questions that we're missing, Jenna, that passed by?
I think I saw one about the age restriction on testing, and there is no age restriction, at least according to Abbott. But something to think about is, if you're going to be testing students, think about how you will stand up consent, right? If you're going to be getting consent ahead of time, like a blanket consent or appointed time consent, so you should consider that. And then as well as what is your swabbing strategy? So the younger the person, the more difficult it's going to be for them to be able to swab themselves accurately. And so if you are thinking of testing younger children, you might want to do that, I guess, full service swab where you have a staff member doing the swabbing.
Perfect. All right. Well, I think this is a great opportunity to close out. Hey, Jeff, do you want to close us out and we can tag team on that if there's anything else that I can add?
Sure. Just want to say thank you again for joining us today, and a special thanks to Becky, Natalie, and Jenna for joining, and for the entire team at DHHS for making this opportunity available for our non-public schools, but also for all of the support you guys have been providing. So I know this resource hopefully will be helpful to all of you out there, and look forward to helping to support you further in the future. Becky?
Thank you so much, Jeff. And y'all, thank you, Natalie. Thank you, Jenna. Folks who joined us today and you had to enter your email address to come online, you'll receive this video link. We'll put it up on YouTube, and that will go really, really well, won't it, Jeff? We'll totally do that without a hitch. It was totally not
Fingers
hard.
crossed.
It'll go
Yeah.
great. And then we'll also send out the slides, and we'll do that as soon as possible. And thanks in advance to Shanae in the in DOA for helping us get that out, not just to folks who joined us today, but to all non-public schools. And with that, we're going to close out and sign off. Thank you all so much for joining today, and have a great Friday and a great weekend. Bye.
Thank you.